Hi, I'm Angela Sabia, and I'm going to be doing my skin, hair, nails, head, and neck exam on my mother, who is my patient today. So looking upon the general survey, we're going to look at overall appearance, orientation and speech, emotional state and behavior, as well as hygiene, dress, and any unique or concerning features. Upon general survey, I'm noting everything is normal. Patient is not in emotional distress. Orientation and speech are intact, as well as hygiene and dress. Next, upon skin inspection, I'm going to look for color and uniformity, which I don't see any discoloration, as well as I don't see any pigmentation changes. And I'm also going to be looking for rashes, lesions, or bruising, which I don't note upon general inspection. And I'm also going to be looking for vascularity or edema, especially edema on the dependent extremities, which I don't see. Next, upon palpation, I'm going to be palpating for temperature. Temperature is nice and warm, as well as moisture. Moisture is good. I'm also going to be looking for turgor. I'm just going to pinch your skin here real quick. Turgor is generally good as well. I'm also going to be palpating for edema, which I don't feel any sort of pitting edema at all, as well as on the legs. No pitting edema noted. I'm also going to palpate for any texture or lesions, and generally the skin is very smooth. No abnormalities whatsoever. Next, I'm going to be examining the hair and nails. The hair, I'm looking at the color, palpating the texture, and distribution is generally good. I'm also going to be looking at the scalp for any conditions like lesions, scaling, or infestations, which I don't see any sort of lesions, scaling, or any infestations of lice or anything. Next, I'm going to be looking at the nails. So I'm looking at the shape, length, and cleanliness. Shape, length, and cleanliness are generally good. I'm also going to be looking at the color and the capillary refill. The color is generally pink, and capillary refill is less than 3 seconds on all fingers, which is great. I'm also going to be looking for clubbing, pitting, or splitting, and I don't see any sort of clubbing, pitting, or splitting at all on either of her fingers, which is great as well. Next, I'm going to be looking at the head and inspecting the symmetry and shape. Generally, the symmetry and shape is really good. No issues there. I'm also going to be looking at the ear position. The tip of the ear should be at or above the outer canthus of the eye, which for both ears is correct. Palpation, I'm also going to palpate the scalp for tenderness or lesions, palpate the hair for texture and distribution as well. So no tenderness or lesions, hair is fine, texture is good. Next, I'm going to be inspecting the neck. I'm going to be inspecting the neck for symmetry. I'm also going to be looking at the trachea to make sure that it is midline upon inspection, which it is. And I'm also going to be looking at the thyroid area for any swelling, fullness, or prominences, which I don't know anything out of the ordinary inspecting her thyroid. I'm also going to be looking at her substernal notch. I'm just going to pull your shirt just a little bit. No any respiratory changes or any pulsations, which I do not see upon inspection. Next, I'm going to be testing her range of motion. So we're going to do flexion, extension. I'm going to have you tilt your head all the way back. And also I'm going to have you go side, and then also this way. Good. I'm then going to be testing her cranial nerve 11. So have hand on her shoulder here, and try to tilt your head against my hand, or turning sideways like this. Good, thank you. And then just the same thing on this hand too. Good, thank you. I'm gonna have you shrug your shoulders against me for 2 seconds, okay? 1, 2, thank you. And her cranial nerve 11 is intact. Next, I'm going to be palpating the 9 lymph nodes. So we're going to be palpating the occipital, post-auricular, the subtonsillar, preauricular, the submandibular right here, the submental, and then I'm going to be going down along her neck for the posterior cervical. And I'm also palpating with my finger pads of 2, 3, and 4 on both hands. And then when palpating her anterior cervical, I'm going to palpate one side at a time to make sure I'm not massaging the carotid sinus. I'm also going to be palpating her supraclavicular. Upon palpating all 9th lymph node chains, I do not know any tenderness, no changes in size, mobility, and consistency is good, no enlargements whatsoever. Next, I'm going to be inspecting her thyroid. I'm going to be doing the posterior technique. And so I'm going to go behind her, rest my hands at the clavicles, and then I'm going to have you look this way. I'm going to displace her trachea on this side and palpate her thyroid from here. Okay, thank you. And I'm going to have you look the other way. Displace her trachea here and palpate her thyroid on this side. Okay, thank you. I do not know the size is good, no nodules or tenderness, and no enlargement on her thyroids. Last but not least, I'm going to be auscultating her carotid arteries while using the bellow of my stethoscope here. And I'm going to ask her to hold her breath for about 3 to 5 seconds, and I'll also hold my breath as well. And I'm going to be listening to lower and upper carotid areas. And I'm going to note if there's any bruit or not. Okay, I'll have you hold your breath. Ready? Hold your breath. Okay, go ahead and breathe. Thank you. We're gonna do this side. Ready? 1, 2, 3. Okay, thank you. And just 2 more times. 1, 2, 3. Okay, thank you. Breathe. And then last time. 1, 2, 3. And breathe. I did not know any bruit upon auscultation. If I did, I were to palpate. But that is the end of my exam. Thank you very much.